Hello everyone, my name is Dr. Shashi Vardhan Janjirala. I am consultant interventional cardiologist at TX Hospital, Banjara Hills. Today we are going to discuss what are stents and where do we predominantly use them. So as we talk about stents, so predominantly you might have heard it from using the stents in the coronaries. Coronaries are the arteries which take blood to the heart. So we usually have three major vessels in the heart and multiple small branches from it. The three major vessels are left anterior descending artery LAD and LCX and RCA. So whenever you have a blockage in it, doctor will advise you to put a stent in it to open the blood vessel such that the blood flow goes to the distal part, means lower part of the body, of the heart. So such that the patient will get relieved from the pain, and it will be, means it's a classic standard treatment for the coronary artery blockages. So depending upon the lesions, a single stent will be advised or double stents can be advised. So going back to the history, we used to have bare metal stents, so without drugs. Recently, there are many companies. We are only most 99% we are using only drug eluting stents only, and we have got so many drug eluting stents. We have got sirolimus, we have got everolimus, we have got zotarolimus. These are drug eluting stents which we use in a coronary artery blockage. So other than coronary artery blockage, there are other places where we put a stent. So what are the other areas where we usually put a stent? There are some arteries. Arteries are the blood vessels which take blood to the specific organ. So the blood vessels which take blood to the brain are carotid arteries. So the carotid arteries usually they are here. So in this carotid artery, we have an internal carotid artery. So in internal carotid artery, when there is a blockage, patient will present to the hospital as a stroke. Means a paralysis of right upper and lower limb or paralysis of a single arm, he usually present in that manner. Or there is a temporary paralysis for the patient, means patient will have paralysis, weakness of right upper limb and lower limb for a brief period of up to around 24 hours, and after 24 hours it can come back to normal. This phenomena, means this disease is known as transient ischemic attack. In these cases, most of the patients present to neurologists or general physicians, they advise MRI and MR angiogram, where we can see the internal carotid artery blockage. So we put stent across this internal carotid artery and open it up such that there won't be any other future episodes like that. So one indication is we put a stent in coronary arteries, that is the blood vessel which is taken to the heart, and the other indication is to the one which takes to the carotid artery. There are other places where we use stents to open up the artery to remain the patency of the vessel, to maintain the patency of the vessel. The other thing is subclavian artery. Subclavian arteries are the blood vessels which we take to the blood to the hands. So these are the arteries which usually have right and left subclavian arteries. When these arteries occlude, means close, then there will be a weakness means pain on when you use this hand. If there is a blockage in the left subclavian artery, preferably patient complains of pain while using this hand. So there is, because the blood supply to that hand is reduced. So eventually the same thing can happen to the right side also. So in some cases what happens is suddenly there will be blue and swelling of the hand. That is called acute occlusion of the subclavian artery. There are many conditions where we put a stent in the subclavian artery. So in hand deformities, means blockage related to the subclavian artery, we put a stent across the subclavian vessel. And other thing, we usually keep stents to the renal arteries also. The blood vessels which take blood to the kidneys are renal arteries. So in renal arteries, if the blood vessels occlude, what preferably happens is patient presents with pulmonary edema, that is sudden shortness of breath. In medical term, it is known as flash pulmonary edema. So in flash pulmonary edema cases, we evaluate the patient. These patients usually present to cardiologists, or they might present to pulmonologist. They can be visiting the clinics in general physicians. There they will advise for some renal Doppler. If there is some problem in the renal arteries, then they will refer the patient to us. We will put a stent across the renal arteries either from going through the groin or from going through the radial vessels. This is another indication where we put a stent. And other blood vessel where we put a stents. These are a very big blood vessels like femoral arteries, the blood which take blood to the lower limbs. There, if the blood vessel occludes, patient usually presents with cramps. When he walks for a particular distance, he tells that I am having so much of fatigue that initially I could able to walk 1 kilometer or so. Now I am hardly taking few steps. I am having pain in my both of my legs. So then we evaluate for the lower limb blood vessels. This what we usually do is peripheral angiogram. Like the angiogram which we do for the coronary arteries, there is some angiogram which we do for the lower limb blood vessels. So if there is some blockage in the blood vessels like femoral arteries or popliteal arteries or some below knee arteries like anterior tibial, posterior tibial and peroneal arteries. So then we open the blood vessels using the stents. So we put a metal across the blood vessel such that it doesn't close back. So these are the preliminary indications where we usually do all the interventional related things with the stents.